Dear friends, today we are going to discuss about the link of male infertility with psychological stress. Nowadays in clinical practice, we are encountering that there's an increasing number of couples coming for consultation of infertility issues. They are unable to have kids, and this incidence is increasing over a period of last few years. Male factor infertility is responsible for one third of the cases. Up to one half of the cases, males have the issue with their sperm counts or sperm functions or morphology, and uh, they are the ones who are going through some medical issues because of which their fertility potential is low. So why this increasing incidence is being seen in the community, and what is the link of psychological stress with this issue? If other factors remain the same, like other medical issues, smoking and congenital issues, genetic issues, then in spite of those factors taken into consideration, the male infertility incidence has been increasing over the last couple of years. Somewhere it has been found that psychological stress, which is a part of urbanization, our lifestyle, our never ending rat race, and the emotional trauma which we go through every day, either because of the financial stress, the work related stress, or family issues, or any other issue for that matter. Somewhere the modern lifestyle is responsible for that. And it has been found that it is negatively affecting the fertility potential, the sexual health of males. Why is it so? So there are a couple of reasons for that. Somewhere the stress is responsible for bringing about some changes in the hormones and neuroendocrine function and the vascularity of the organs in our body. If we see that the psychological trauma or psychological stress is responsible for increasing the level of cortisol in the body. The cortisol is a steroid hormone, and it somewhere affects the 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 sperm production capacity of the testes. It reduces the production of testosterone from the testes, and this leads to increase in the infertility problems in the men. Some hormones which are produced from the adrenals, which is a gland present above the kidneys, which is responsible for producing sex hormones, that also is responsible for that the functioning of adrenal is in fact affected because of psychological stress, and that leads to issues related to the fertility. Then some other hormones, some neuroendocrine changes, luteinizing hormones, which are the sex hormones, the release of these hormones is affected from the brain because of psychological stress. Psychological stress can also happen because of the infertility itself. If a couple is going through the treatment for infertility and they're not able to have children for a couple of years, they have to go through IVF cycles. That itself is a psychological trauma in itself. That reduces the libido, the sexual health, erectile dysfunction, ejaculation issues, and the sperm parameters as well. So somewhere everything negatively affects the sexual health, including erection issues, including ejaculation issues, and the sperm parameters as well. So somewhere we have to take care of our psychological health as well. We should adopt a healthy lifestyle, cut down the other risk factors, including smoking or excessive alcohol or drug abuse. So we should try to cut down as many factors as possible which are responsible for sexual health and fertility. So in spite of taking care of these issues, we should, if there's any problem, we can consult a urologist or andrologist for this issue. They can check other parameters and start medications to improve the sperm health and sexual health. You should take counseling sessions if you are unable to cope up with the emotional trauma, psychological stress going on in your life, and that should improve the overall health in general, and apart from that, the sexual health in specific. Friends, this is Dr. Aman Gupta, urologist and andrologist, Fortis Hospital, Vasant Kunj, New Delhi.